Understandable. How would this virus or disease like HIV, I read in some sources is maybe the symptoms not exist even 10 years. So how this virus still in our body without any something we can know?
The question is that for some cases of HIV, the virus may exist in body, for example, for 10 years without any signs and symptoms. Without any signs and symptoms means that our immune system are not so intact, because with interaction between virus and immune system, some signs and symptoms should reproduce. But if the immune system is less effective due to, for example, some medications. Nowadays, many people have organ transplantation. Okay? For example, kidney transplantation, or heart transplantation, or liver transplantation. After transplantation, we use suppress immune system by giving some medications, because immune system otherwise will reject transplanted, okay? Or in many other immune disorders, we suppress the immune system. So by suppression of immune system, the interaction between virus and body is not a complete interaction. So the virus can replicate, but without annoying the body, okay? So in these cases, or in other cases, malnutrition can reduce the immune system. Stress can suppress the immune system. Yes? Yes? Yes.
So the subclinical is more dangerous than preclinical, because the preclinical one, you're infected by the virus, it does not transmit. You feel the symptoms disappear, like influenza. Influenza does not transmit it to people, just only when sneeze or cough transmitted. While the subclinical doesn't it's transmitted without symptoms, like as you say, virus.
You are right, but I will give more explanation after hearing.
Subclinical diseases. If we have disease, we have symptom or sign. You said subclinical disease without any sign and symptom. Then how we can find or discover if we have disease or not?
Okay, thank you for your questions. Let's start by there is a term isolation and quarantine. Isolation and quarantine. What is the difference between quarantine and isolation? Have you ever heard quarantine? I don't know the translation in Arabic, but in Persian you can say quarantine. Maybe the same in Arabic. In quarantine, we separate people. In quarantine, we separate people who has contact with the patient but do not have any signs and symptoms. So,
Doctor, how we can know or discover about this disease?
the problem is that let me give you an example. Let me.
Spell these words, right? Spell. No.
I'm not sure. We can check it. It may be an error in the spelling. The question was that how can we find that some people is infected without any sign, without any symptoms? Okay. An example is that let's try to explain the difference between isolation and quarantine. In isolation, we separate some people who have signs and symptoms. We know that somebody has coronavirus because he or she coughs, he or she has fever. We have some, PCR test, and the positive result of PCR shows that he or she has the disease. Okay, we separate these people in a separate room until they discover. After recovery, the people are disease-free and they cannot transmit the disease. This is called isolation. But in quarantine, I'm working in a hospital that some people have coronavirus. Before going to the community, the Minister of Health tell me that you have exposure with coronavirus. You may be infected, you may be in a preclinical or subclinical phase. So we have to separate you without any cause of any sign or symptoms of disease. But I just had exposure with people. And the Minister of Health knows that the incubation period between exposure and appearance of signs and symptoms is 1 week. It means that if I have infection, the signs and symptoms should be evident after 1 week. And after 1 week. If I was, yes, a few minutes later. If I am in a preclinical phase, but there is another case that I am in subclinical phase. In subclinical phase means that I have infection, I do not have any signs and symptoms right now, and I will never reveal any sign and symptoms in the future. Because I said to you that in subclinical phase, signs and symptoms are not present and will not occur in the future too. Okay?
So the human is normal and
Yes. But if I have exposure, I will be separated for 1 week from healthy people.
I mean after 1 week.
After 1 week, they give me an applicant and does
We
the
have never
PCR
seen
test.
symptom or sign in the future, you said.
If the signs and symptoms appear, then I will go from quarantine to isolation because it shows that I have the disease definitely. So they isolate me after recovery. If no sign and symptom will appear after 1 week, then PCR test tells whether I have infection or not. If the PCR test is negative, it means that the exposure did not occur in the past, so I can return to the population. If the test is positive, they will take me in quarantine after the PCR test. The repeated PCR test gets negative.
Doctor, that's followed or considered a preclinical disease.
Both preclinical and subclinical disease. In other terms, exposure, there is exposure three consequences after exposure to a virus may occur. Clinical disease. If the clinical signs and symptoms appear, we isolate the people after until recovery. If there isn't any sign and symptom, he or she may be in preclinical disease. We don't know. We quarantine them, and then we take PCR tests. It may be in subclinical. Again, we quarantine them and take PCR tests. There is a fourth situation. The people may have exposure without an infection. Healthy people also should be quarantined because when a person does not have any signs and symptoms, we do not know which situation is correct. There is three possibilities. There is no infection after 1 week, no signs, no symptoms, no PCR positive test. If there is a preclinical phase, after 1 week, clinical signs and symptoms will appear, and by appearance of clinical signs and symptoms, we isolate people. If there is subclinical infection, after 1 week there is no signs and no symptoms, but PCR test gets positive. We will PCR. Do you know what is PCR? In coronavirus.
They check that coronavirus from the oral cavity.
Yes, from oral or from nose. PCR is a test that can show only just one virus. If one virus, even one particle of virus enters my body or exists in my secretions of the oral cavity,
Like some protein of virus.
the DNA of virus, not protein. In PCR test, we look for DNA or for nucleic acid of virus. Even one particle can, give me or give us positive results. So PCR is very important. But in subclinical or preclinical phase, PCR test may be negative because the virus enters my body. But for presence in body secretion, it should replicate, it should reproduce itself. So if I have exposure with the people who have coronavirus, the virus might enter my body without PCR positive test. Because after a few hours or a few days, virus will replicate in my body. After replication, it can be present in body secretions. Even by talking, I can transmit the virus. You don't need to sneeze or to cough to transmit the disease. When I talk with you, some very small particles will go out. When I touch my eyes and then touch the table, and then you touch the table, you can get some small particles from my eye secretions to the table and from table to you. This table is a common vehicle, okay? So these are some examples from isolation and from incubation and quarantine. These are out of the scope of our class. We just talked about this as an example. Don't worry. What is important for me is just differentiation between clinical and non-clinical. Non-clinical may be in a preclinical phase, means that signs and symptoms will appear later. Subclinical means that there isn't any signs and symptoms and they will never have any signs and symptoms. Persistent means that there is a long period, many years, there are many years subclinical phase. For many years I can transmit the disease without any signs and symptoms. And latent phase is also similar to the subclinical phase. There are some minor differences that are not important for me. Just what is important for me is differentiation between clinical disease and non-clinical disease. It is enough for our,
There are some clinical diseases different between one person and another person.
Sorry?
Subclinical disease is different between one person
Yes,
and
yes.
another person. It's related to the immune
It's
system.
related to the immune system, related to food, it's related to,
To the arousal.
to the other chronic diseases that I have. If I have asthma, the severity of disease may be different after getting virus of coronavirus. If I have, for example, chronic heart disease, again the chance of the sign and symptom is very different.
Doctor, that means just the clinical disease we can use with them isolation.
Yes, isolation is just for clinical disease. For non-clinical disease, we use quarantine. Quarantine means that the people, as exposure, some people have the disease, and we don't know whether he or she is healthy, is in preclinical phase, or in subclinical phase. We should wait. After a few months, a few days, a few hours. For example, in some cases, in animals, the quarantine may also extend to 40 days. And quarantine means 40 in italic.
Doctor, why we don't use examination, analytic examination?
Because in the earliest stage, no examination is positive. As I mentioned earlier, after a few hours of exposure, there isn't any antibody, there isn't any PCR positive test, because all of these markers need some time to appear. Maybe 1 week, maybe a few days. So paraclinic is very important, but after, for example, antibodies usually need some weeks to appear. Antibodies need some weeks to rise the level of antibody. Okay, so we need some quarantine. And for some new diseases, there may be some new diseases. For new diseases, there isn't any laboratory. For example, for coronavirus in 2019, there was not any clinical or any paraclinical procedure to
Maybe after 2 weeks he will die.
he or she may die, but our main objective is to protect the community. The community is more important for an epidemiologist than the one individual. Okay, one individual, we try to help him, help her. We try to save the patient, but our main goal of vaccination, our main goal of public health is to prevent the community, the
One
population.
person is not important comparison with the society.
Yes, one person is not as important as a society. One person is also important, but the more important thing is the society.
Yes.
And there is a difference between clinical, medicine and social medicine. In social medicine, our main focus is on the society as a whole. Okay.
Because either in the social medicine we focus on healthy people.
No, in social medicine, if, for example, you are in charge of, a health authority of a city, that 90% of city have a chronic disease. So social medicine is that you should focus on the whole society, that all of them have the disease. In the past, there were some cases, some villages that more than 95% of the village were infected with some parasites. 95% of the village had the parasite. So in this village, social medicine means that pay attention to the people who have the disease because they produces the society. Okay? So the majority of people are important for social medicine. Okay, let's increase our speed. There are three terms that are very important in transmission of disease: endemic, epidemic, and pandemic. Endemic means that we expect some fluctuation, some amount of disease based on our previous exposure. For example, in a hospital or in a city or in a factory, in a society, we know that each year we have some cases of cholera in warm seasons. Some cases of cholera will occur. For example, less than 20 cases of cholera is expected. So if in the future year we, for example, have 20 cases of cholera, we know that this is habitual. This is expected for us. But if in previous year we had about 10 to 20 cases of cholera, and this year we had 100 cases of cholera, this amount of, or this number of diseases is beyond our expectation. Then the number of disease exceeds our expectation, it is called epidemic. When the number of cases are in our expectation, it is called a habitual presence of disease. So in a society that we don't have any case, any history of disease, only 2 cases can produce an epidemic. Because our expectation of, for example, smallpox, we don't expect to have smallpox, even 1 case of smallpox in this community. So if just we observe 1 smallpox, it will be called epidemics because our expectation is 0.
So what does smallpox mean?
Smallpox is a viral disease that have been eradicated.
Judari.
Sorry?
We said Judari.
Judea.
Yes.
Smallpox is eradicated.
Small?
Smallpox.
Chickenpox.
You say in Persian, obele. In Persian, we call it obele. About for the poliomyelitis. Poliomyelitis is a kind of paralysis of children. If we have a few cases each year, it is our expectation. So it is called endemic. If the number increases dramatically beyond our expectations, we call epidemics. This shows an example of endemic. In endemic, small number of cases are occur each year in these locations. But in the middle of the picture, the number of cases in North Africa increased much more than our expectation. Our expectations comes from previous examinations, comes from previous count of the disease. If the epidemics occurs in multiple countries, beyond a continent, South America, North America, Africa, and Europe, we have multiple, simultaneously in multiple countries we have epidemics, it will become a pandemic, such as COVID-19 pandemic that all continents, all countries in the world have experienced the cases or some cases of disease that were beyond their expectancy. Our expectancy of the number of COVID-19 disease was 0 because we didn't have any case of this disease. So just after a few cases in China, they announced an epidemic in China. When the disease spread from China to Italy, to Iran, and to some other countries in Europe, the pandemic has been announced because from Asia, the disease has spread to the Europe and to Africa.
Doctor, endemic is a chronic.
No, pandemic can be also acute.
No, endemic.
Endemic means that the disease is repeatedly observable. The disease may be acute. Chronic means that the disease itself is prolonged. For example, a disease that persists for 10 years in the body, it's called chronic. Okay? But the diseases such as cholera may be acute. The cholera course usually are in 1 week or are limited to 1 to 2 weeks. Okay? But each year we have this disease. The disease is very short, but the repeated occurrence is called endemic. So endemic is not chronic.
Endemic mean this area is population by this virus, or this virus starts from this area?
No. Epidemic, the virus may enter from outside of the country, the virus may replicate inside the country, the source may be inside, but due to some reasons, the virus spreads more. For example, due to suppression of immunity, due to changing of nutrition habits. There is, in some countries, the fishes are polluted by lead, by some heavy metals. Maybe more important than lead is mercury. For example, in Japan, due to industries, the fishes are polluted with mercury. Some people who use fishes show some signs and symptoms of pollution with mercury. If the number of people who use fish as a food is increasing in the future, the number of people will also increase without any increase in the source of the population. Just the changing of food or nutritional pattern can increase the number of cases. So we will see an epidemic of food poisoning by mercury just due to changing in nutritional habits. Okay?
There is a special number for each of them.
Sorry?
Special number of each of them.
No, we don't have any special number. It just depends on the previous exposure. If the previous exposure is like that, from 0 to 20, then 50 may be regarded as epidemic. If there is a constant number between 0 and 2, then 5 may be regarded as epidemic. It's just related to the, as I've said before, everything is related, is dependent on everything else. Okay, let's continue for less than minutes and then have a break. 5 minutes.
ارجع
بليت وبعدين طيب.
بعده
There are
بعد
some slides have been talked about, okay, earlier, so we can spare time. Sure. So please be here just on 10, okay? 10 sharp, 10
طيب،